Welcome to another wonderful episode here at Doctors of Podiatry. We're going to be presenting today a very interesting case. We have a young gentleman who recently presented to our office with pain to the right heel, times several weeks. The pain from the clinical presentation has been affecting his daily life activities. The patient is, in your opinion, you're on your feet how many hours a day?
More than at least 8.
8 hours a day. He presented with heel pain. The initial diagnosis, plantar fasciitis, plantar fasciosis, heel spur syndrome. Again, something that we see a lot here at Doctors of Podiatry. I'm going to take you guys through the entire story from start to finish, like I did with the case the other day. I'm going to go ahead and I'll show you guys how we numb the entire area, and then we'll edit that into the actual procedure. What we're doing today is a percutaneous microtenotomy, a dry needling procedure, in conjunction with PRP, platelet-rich plasma, to continue our efforts to maximize his improvement and minimize any long-term complications. Our job is to heal, and that's exactly what we're gonna go ahead and do, okay? So the first thing that we do is a really important nerve, the main trunk nerve, called the posterior tibial nerve. And it runs right here with the main artery of the foot, as well as the vein. So without further ado, I'm gonna go ahead and ask the patient to, there you go. So I already marked the tibia. And what I'm looking for is the artery. If I find the artery, which is right here, the nerve is right next to it. Here we go, bud. Little pinch. So what I'm looking, I don't know if you guys are gonna, we may or may not see it. If we see blood, okay. Here we go. A lot of burning, bud. A lot of burning. I pull back to make sure that we're not inside the posterior tibial artery. Okay. We pull back again. Then I'm going to redirect a little bit further in. Oh. Did you feel anything there, bud? No? Now what I'm going to do is I'm going to come out a little bit. I'm going to redirect the needle just a little bit this way. I'm going to go ahead and infiltrate some more here, and we'll stop here. Now what we're going to do is, once the posterior tibial nerve runs around here, there are some smaller branches. So what I'm going to also do is I'm going to now numb this area here. This may also be a little bit uncomfortable. Okay. Little alcohol swab here. And a little stick. Sorry about that. A lot of burning. A lot of burning. This is the worst part of my job, everyone. Okay. So we got the trunk, and just like a trunk, like a tree has branches, then we got the the little branch here, I'm gonna wait about 20 seconds for this to get a little bit numb, so then I can give him one little last stick here. Okay. As everyone can already see, I've already made my grid for the needling before I numb, right? Because if I numbed them before I did the grid, then I wouldn't be able to isolate the pain. Okay. You're gonna feel pressure. Difference between pressure and a little bit of pain, okay? One last little stick. Here we go. Let's try to move you. There you go. And just in case, we'll use the little spray here. Okay. Okay, and here we go. Just in case, we always pull back. Okay, and we're done. Now we let the area marinate. See you guys soon. Welcome back. I was just talking to the to this very pleasant patient about, how do we define success when we talk about regenerative medicine? This is not a miracle injection. I continue to stress that to patients. Our job is to try to make things better. How much better? I said it before, I don't care. I really don't. What I care about is getting the patient better. 30, 40, 50, 60, 70% better. That's how we define success. That's exactly what we were just talking about. It's really important to, for doctor, obviously, patient, and the community to understand that these are not miracle injections. This is a physiological process, a process that takes time, right? 3, 4, 5, 6 weeks, there's got to be a connect, not a disconnect between the procedure that we do and brain. I'm not going to get into the physiology of exactly what is supposed to happen and what happens, but it's very, very important that in respect to expectations, that we're all very, very clear. And that's why I also like these videos, because I can talk out loud, be very transparent, and the patient is, and family, everyone's listening to what I'm saying. So the patient is already numb. So we're going to go ahead and move forward with the first part of the procedure, which is very simple, the percutaneous microtenotomy. Excuse me, a little under the weather. So what we're going to go ahead and do, it's a small needle. Okay, small needle, and let's now focus on this. Okay, here we go. So what we're going to go ahead and do is, okay, and if you feel any discomfort,
let you know.
Please. Sometimes I do it just very quick. Sometimes the patient will feel a little bit of sting here and there, maybe not. I don't know how you doing up there, bud? Me too.
You're doing the poking, why wouldn't you?
I like his sense of humor. I love patients with a great sense of humor. And I can actually feel that celery-like feeling. You guys obviously can't, but I can. And I'm taking the opportunity, because it's such a tiny needle, we're using even a smaller needle today, I'm taking the opportunity to really just create that micro trauma. Do we have a good feed? Mm-hmm. Okay. We have a really good the anesthesia is phenomenal, and I really, really, really want to get this patient better. Okay, so that's the needling. And now we're going to take PRP. What's interesting about the acronym PRP, which is actually really, I mean, talk about a coincidence. PRP stands for platelet-rich plasma. And PRP in Spanish, plasma rico en plaquetas. What are the chances of the acronym working for both Spanish and English? Have you ever thought about that? Isn't that great? And I will start doing these videos in Spanish because I've had an influx of a lot of requests to please do these in Spanish. And that's our next little project. We do live in Miami. Spanish is around a little bit, sort of. So what I'm going to do is, this is a bigger needle, clearly. So what I'm going to do is, I'm going to go ahead and come in through here. Okay. I'm going to move a little bit forward. I can already feel the ligament. Right. We're going to leave it there. The needle, the tip of the needle is right about here. And now we're going to infiltrate. I already told the patient that if he feels any discomfort, please let me know. How you doing up there? Pain? Pain? This is a big needle, so I don't want to infiltrate really, really quick. You can see that the juice is flowing quicker. The PRP, the juice. Okay. Now I'm going to stop there. I'm going to redirect, just like this. Would you okay? Okay. Here we go. A little bit more. I'm actually trying to get to here, everyone. Okay, here we go. Please tell me if you feel any discomfort. Very slow. You want everything to just stay there. Stay where? There. I'm gonna go ahead and remove. Sorry about this. I apologize. Discomfort? And right here. I love this procedure. I've done thousands of these, and just like ingrown toenails, they simply never get old. And part of the reason why I love this procedure is because it works. So I get happy knowing that this patient will do better. How much better? That's the $1,000,000 question. Quick recap: microtenotomy, the dry needling, subsequent PRP. The patient will wear a boot, and we have crutches already. He's going to stay off of it. We'll discuss the post-procedural protocol. And again, for all the people out there that may be suffering with heel pain, my recommendation always: don't wait. Don't think that it's going to get better. That's historically speaking, that's what a lot of people come in after, 3, 4, 5 months. They're like, I should have come in before to see you. If you have heel pain and you're trying to fix it on your own, or sometimes it feels better than other day, do not wait. See a podiatrist, any podiatrist. Okay, that's my recommendation to everyone when it comes to heel pain. Like always, thank you for watching. www.jawspodiatry.com, Instagram Dr. Tojam, Facebook Jaws Podiatry, and last but not least, our YouTube channel, Jaws Healthcare. Have a wonderful weekend, everyone. Thank you for watching.